Now on the American Health Journal. Are you experiencing nagging headaches and your doctor can't seem to find the root of the problem? Well, maybe the answer might be with another healthcare provider, your dentist. We spoke with Dr. Patrick Cohen in Beverly Hills about headaches and TMJ.
People call it TMJ. It's actually the joint where the upper jaw meets the lower jaw. So if we were to look at this being your upper jaw and this is the lower jaw, they meet there, and that's actually called the TMJ. It's probably the most complicated joint in your body. We've got a whole bunch of nerves and blood vessels that are back in here. We've got muscles surrounding the joint completely. So all these muscles around here all affect the jaw joint or the TMJ. Symptoms of TMJ can include pain in the jaw joint, okay, headaches, migraine headaches, congestion of the ears, dizziness. We can have people that have ringing in their ears, tinnitus. We can have people that have neck aches, problems in their neck, stiffness in the neck. We've got people with tingling in their fingertips. All of those can affect the TMJ. There is a small faction of dentists who have been treating it using a technique called neuromuscular dentistry, which has been around for about 30 years, but it's just in the last 5 or 6 years that it's starting to get more popular and bigger because the results that we're seeing from it are much better. So what we do is we'll see somebody, they come in, we'll put them on what we call the TENS unit, which is the transcutaneous electrical neural stimulation unit. It's a low frequency unit, and what it does is it stimulates the nerves that control all the muscles of the head and face. And actually now we even have one that also stimulates the muscles of the neck. And by stimulating those nerves, what we're doing is we're getting the muscles to relax. By getting the muscles to relax, we're getting all of the lactic acid and waste products that build up in those muscles flushed out, okay? So in theory, the theory behind the headaches and the neck pain and everything is that these muscles are in constant contraction. And that's actually one of the reasons why people grind their teeth, is because of the fact that the muscles aren't in a comfortable position, so they're trying to get the jaw to move into a comfortable position, and they're grinding their teeth because the teeth are getting in the way, and that's setting the whole thing off. Once we've gotten the muscles relaxed, then what we do is we make them a thing called an orthotic, which can either be a non-removable or a removable appliance that keeps the muscles in that set position where we know for sure they're relaxed because we relaxed them. They wear the orthotic, and usually they'll wear an orthotic anywhere between 1 and 3 months, okay? And during that time, we'll make little adjustments, and it is reprogramming these muscles and the jaw joint to sit in a comfortable position. Dee came to me with a history of chronic headaches, migraine headaches. They'd been going on for about 2.5 years. She had some neck problems, but it was to the point where it was debilitating. She could not get out of bed some days because it was so bad, and had seen numerous physicians and had tried acupuncture and everything else, and nothing seemed to work.
After the very first session, he did some measurements on me, and he did the TENS unit on me, and right away I felt better. And I'm going, this is great, this is wonderful. I'm going, this is it, I know this is it. And then we came back in and he did the impressions of my teeth to build my orthotic, which I'm currently wearing now. And I've been wearing it for about a year now, and my migraines have gone from 7 days a week, from a severity of about a 4 up to a 10, down to maybe 1 a week, and the severity maybe gets to a 4. And that's it. So it's like a whole life change for me. Oh, it's wonderful. I'm so happy.